It's absolutely disgusting. I don't think there's any care or compassion behind. I just don't think it's fair for staff to be put in this situation.
He jumped out and aggressively showed me he's got a camera and he wants to record me giving my identification.
It really is of concern to think that nurses are regularly, it would appear, being fined for being at work.
This is the journey neonatal nurse Lisa Dugen takes to get to work at Milton Keynes University Hospital. It's simple enough, that is, until you try to park. She's had multiple fines and was told she could even face court.
What was the first fine that you got?
So the first fine I got was probably about 2021. It was an afternoon shift, which is always really difficult to park in the hospital because of limited spaces. So you tend to go to work early and hunt for a car parking space. Some people come in an hour early to look for a space. By this time it was getting late and I just took it upon myself to park in a public car parking space. Left a note in the on the dashboard saying what had happened to explain my situation, and then I got a fine a couple of weeks later.
How much was the fine?
In the end, it ended up being over 200, nearly £300.
Gosh,
Yeah,
that's a lot.
yeah. It kept going up and up and up. I kept trying to put it off, but I got quite scared and I was becoming quite stressed with the situation. So I felt there was no other option but rather than to pay.
The initial fine for Lisa was under £100. She appealed, but the parking company rejected her explanation. Despite having her £20 a month staff parking permit on display, she had to borrow money to pay for the ticket. The hospital told us Milton Keynes University Hospital requested UKPC to desist, but they declined to do so. They took enforcement action independently and we had no authority to overturn it. We have since terminated our relationship with UKPC and appointed a new parking provider. UKPC did not comment. And Lisa's story isn't unique. She's one of tens of thousands of NHS staff who've received a fine. I've come to South London to meet cancer patient coordinator Shakiba Robinson. She's had nearly 200 tickets in the last few years.
So there's this one, which is June 2025.
Shakiba couldn't afford the £600 a year parking permit, so she tried to park near hospital bins in undesignated spaces.
I'm out of the way, I'm not obstructing anyone. I'm actually not even in a parking space that permit holders would pay for.
But even that didn't work as she was confronted by parking management.
He jumped out and, aggressively showed me he's got a camera and he wants to record me giving my identification. And I just thought, we're in a hospital and I work here and I've got my badge, my lanyard on, I've got a fleece that says St George's on it. Could we not deal with this in a different way? So I'm not trying to step on anyone's toes. I just want to park.
How much did your parking fines come to in the end?
It was around 197 tickets. Because, when you get a ticket and you don't pay it, the price goes up and whatnot. So they had rounded it up to about £15,000 that they say I owed the hospital.
£15,000?
Yes.
Can you afford to pay that?
Definitely not.
As a mother of 4 young children whose mortgage has nearly doubled recently, Shakiba says her budget is razor thin. She doesn't have the money to pay. Her manager has been trying to appeal on her behalf, but as of now, she still owes £15,000. St George's University Hospital's NHS Foundation Trust said, "We know that for some of our 10,000 members of staff, including those who work shifts, driving to work is unavoidable. This is why parking permits are prioritised for those who need them the most." For Shakiba, Lisa and other NHS staff in England, parking has become a battleground. We submitted a series of Freedom of Information requests to see how big the problem was.
We exclusively found that over 25,000 parking fines have been given to NHS staff for around 17 NHS trusts. And we know that there are thousands more. We contacted every single NHS trust with a car park in England. Some of them said that they don't separate between staff and visitors, but we saw the totals, so we know that there were loads there. Some of them said that third-party companies are running their car parks, so we couldn't get those figures. But we know that thousands of fines are being given to NHS staff.
It's really shocking to see it laid out like that, to see the scale of it across only 17 trusts, and imagine what that looks like when you multiply that by the 300 plus trusts that there are in England. Then it really is of concern to think that members, nurses, are regularly, it would appear, being fined for being at work.
Now, this wasn't the case a few years ago. Remember this? We were clapping for carers, and parking was made free for NHS staff in England during the pandemic, but the fees were reinstated in April 2022. There are calls to reverse the charges, though, to make it fairer across the UK. Scotland, Wales, they don't have this problem because they have free parking. What would you say to Wes Streeting about what he should do about this?
Our absolute clear message to both the government and to organisations, the trusts themselves, is they should be providing safe, cost-effective parking or travel means so that everyone can get to work without worry and without actually it costing them an extortionate amount.
The Department of Health and Social Care told me free parking is available for those in greatest need, including all NHS staff who work overnight. Exploitation or mistreatment of hard-working NHS staff is unacceptable. As parking tickets continue to be issued, the dozens of NHS staff that we've spoken to say that the impact of these extra costs could drive them out of the jobs they love.